So now we're going to have a look at Botox. And once again, on our model Gina, we're going to go back 1 month in time to have a look at the before pictures and also seeing the procedure being done. And now 1 month later, when everything has settled and the full effects are in, to see what the result is.
So this is Gina. Gina has been fully informed and permission has been signed. And side effects have been explained to her already. Her main concern are the frown lines. And in this case, Botox is probably the gold standard treatment. The reason being is the movement by the muscles cause the wrinkle to appear. So by paralyzing the movement, it will open up. Her line here, okay, has now become what's called a static wrinkle. There are 2 types of wrinkles. There's dynamic wrinkle, which occurs when there's movement of the muscles. And then there's static wrinkle, which occurs,
is there all the time.
which is there all the time. Now, in her case, she's in a gray area. So it's possible that by doing the Botox, this will gradually smooth out and it won't be as
You mean gradually over a period of time after the first treatment, or does she have to do more than one?
Normally, from my experience, after doing it 2 or 3 times every 4 or 6 months, the muscles that normally cause this frowning movement would have been paralyzed, wouldn't have been working. So the skin is relaxing, it's not being creased.
Okay. So the Botox doesn't fill, what it does is it stops the muscle from moving.
Exactly. You can put a filler over there, but if the muscle is still going to be moving, it can actually move the filler. Also, so if you're going to put a filler over here, ideally first you do the Botox and then you wait a couple weeks and you can then do the filler after.
So you could do both?
You could do both. The filler over here is it's a dangerous area to put filler in because it's possible you can inject into the branch of the retinal artery and there is a slight risk of getting blindness. So I'd rather not do filler in this area. The muscle over there isn't causing this movement. So I'm going to inject in the muscles here to paralyze that movement. Okay. So Gina, I'm going to ask you to frown for me, please. Irabia. Okay, so I basically find the belly. So side effects, mainly we're looking at redness and bruising. 1% get a headache-like pain at the site of the injection. Ironically, 38% of the people who do Botox treatments actually get a reduction in the frequency of migraine attacks. So there's some pathway, they're not exactly sure why. It doesn't work on everyone. My unscientific theory is basically patients who have lots of tension are always frowning.
Yeah,
the muscle here tense. The fact that they're not frowning
releases that tension.
Exactly. Now, for people who have the tension headache or the migraines coming from the base of the skull,
this doesn't work.
It doesn't work as effectively.
Okay,
I'm pressing because some blood came out just to reduce any chance of bruising. Doing Botox is pretty simple. The problem is analyzing the face. Everyone has a different face. Everyone has different skin laxity. Everyone has different skin damage, you know? So automatically when the patient comes in, I'm guessing their age. I'm asking them what their age is to see if I'm correct or to see if they're older. Their skin looks older than what it should be. Normally, it's the smokers and the sun worshippers who have the worst skin. Frown again, Jean. So the general
So
rules.
this doesn't stop all movement, because some people sometimes are worried that Botox is going to give them that sort of like plastic kind of look without any expression.
I mean, there are 2 reasons, my theories for it. Most of it comes from when you do the sides here. Okay, so when you smile, there's a round muscle that causes these lines here. Then there's another muscle from the corner of the mouth to the cheek that pushes up. So if you paralyze the one that pushes up, you're also paralyzing the main muscle that you use to smile. So you'll be smiling funny because the whole upper face would be paralyzed. Okay. Also, this of the frozen face comes from these watching these movie stars, whereby for them it's probably cheaper just to go every couple years and get a facelift done. You know, and eventually their face is so pulled they look like they're being.
So when it's done properly, you have less movement, but you still have a natural look.
Ideally, that's what it is.
That's the look that we want.
Okay, frown again for me. Okay, relax, relax. Okay, here there's another muscle, the protratus, that basically pulls down like that. So you can paralyze, relax. finding all your blood vessels today, Jean. It doesn't start working right away. Okay?
Yes, how long does it take for the effect?
The earliest onset documented is 6 hours. The latest is 2 weeks. Average is after 3 or 4 days. So please don't call the next day.
On the day that you have it or the next day, you're not going to all of a sudden have this fresher look.
You know, it takes a while. It's a gradual onset. And then it lasts normally between 4 months and 6 months.
So do you get a little bit of bruising sometimes afterwards?
Yeah, I'm pressing here to reduce any chance.
To reduce that.
Because we nicked a couple vessels.
And after you've had it done for the first time, when you go home, is there anything specific that people have to look out for, or can they lie down?
What they do.
Can they? Some people have said that you have to sit up afterwards because if you lie down, it moves.
Look up. Personally, you can do whatever you want. These things that you're mentioning. Okay, go back. Early 1990s, there were 2 doctors, Carruthers and Carruthers. One was ophthalmic surgeon, and the other was a dermatologist. I don't know which one was the husband or the wife. And they'd inject the Botox for the people who had the lazy eye. You know, the eye was drifting. And the ophthalmic surgeon would tell them to come back after 2 weeks to make sure that it worked. The dermatologist would start seeing them after 2 weeks coming in, because obviously they got to know each other, and they realized that the fine lines in that area around the eye were also disappearing. So they ditched their ophthalmic and dermatology, and they just went into cosmetics, and that's where basic Botox start taking off. However, they kept giving their patients the same advice: don't lie down, don't go on a plane.
Okay, that's why it's
for the ophthalmic procedure.
All right, okay.
You know, so the only thing I tell them is avoid extreme heat, because Botox in the heat can be deactivated, so it only lasts maybe 4 weeks,
so no
6
beach?
weeks. Well, beach is fine. Avoid anything above 37 degrees. So no heat wave beach,
but
no
sleeping
sauna,
or whatever
no
is
jacuzzi.
just as normal.
Lying down is fine.
Okay.
Also avoid extreme pressure. So no facials, sauna, no facials, massages, motorcycle helmets, scuba diving masks for 2 weeks. And one of the Botox gurus also says no sweating for 2 days. Look out for me, Jean.
Great.
Relax.
Gina, you're going to look about 10 years younger.
So another bonus that you can get from doing the sides of the eyes is, because the movement here of this round muscle around the eyes tightens, if you inject further up, you can actually open the eyebrow further. Now, for women that have arched eyebrows like Gina, it's fine. But for women who have straight eyebrows, if you put it higher, then they're going to look like they're angry. So you have to find the balance. Not everyone can do the same thing. Okay, turn sideways. Smile for me, Gina. All right, relax. And that's it, you know. Okay, I don't think there should be any bruising.
So we'll see you in 10 days' time then, Gina. See how you're getting on.
All done.
Dr. Pillow, tell us, what do you think about Gina and how the effect has worked on her?
Well, she's actually commented that people are commenting to her that her eyes are more open. Okay, because when you do the sides here, it can actually raise the outer part of the eye between 4 and 8 millimeters. The good thing is she doesn't have the frozen look that most people are terrified of when doing Botox. Smile for me, Jean. All right, look up for me, Jean. Look up, look in the mirror. All right. So you can still have those slight movements that probably when you were younger, 18, 20, you know, you'd look up, but you don't get the wrinkles. But looking fresher. All right, so she doesn't look like a statue, and she cannot smile unless she's like this.
I think this is something that people really worry about with Botox. They
It
think
is.
that they're going to really look pulled back. And
The reason being is there are some patients that want that effect where they don't want to move any muscles whatsoever.
Really?
Because they figure, if I'm paying, I want everything frozen. You know, but the whole point is to do it to still have natural movement, but looking fresher. without
Yeah.
giving away that you did something.
Exactly, to look that little bit younger and a little bit lifted.
You know,
a bit.
because then once you pass that basically imaginary border, the imaginary line, and you cannot move, then people are gonna say, that's why she's looking younger. Look, she did something. But the whole goal is for people to say, look at Gina, she's looking good for her age. Damn her, you know, you want them like
Wondering
questioning why.
Not being slapped in the face
Exactly.
with it. So when you're doing Botox then, how long should the effect last?
Well, the peak effect, so maximum effect, you're looking 3 to 4 months. After that, it starts
Dying
decreasing
down.
slowly. Probably by 6 months, you're almost back to square one. There are some people that say that it lasts even longer. It's not that the effect of the Botox lasting longer, it's the effect that the muscle hasn't been used for a while, so it is weaker.
Okay.
So to get that full effect that you had day one, it's like you need to do physio after you put your hand in the plaster. It's going to take
I understand.
longer.
Your face has stopped moving in certain ways,
So the
and
muscles
so it's
became
getting